Cardiopulmonary Resuscitation. When you come across a person who appears to have collapsed, you need to adopt the emergency action plan, which consists of 7 steps. These are danger, where you need to assess for safety; response, send for help; airway, breathing; cardiopulmonary resuscitation; defibrillator. The steps can be easily remembered by the acronym DRS ABCD or Doctors ABCD. Danger. Begin by first assessing the situation for danger to ensure safety for yourself, any bystanders, and your patient. As a general rule, you should avoid moving casualties unless there is a hazard that you cannot remove, such as fire or poisonous fumes. Moving a patient, especially an unconscious patient, is very difficult. Response. Next, you need to check the patient for a response by speaking loudly and giving simple commands such as, "Open your eyes," "Squeeze my hand," and remember to try both hands if a stroke is suspected. Then, grasp 2.5 to 5 centimeters of the trapezius muscle close to where the shoulder meets the neck. Squeeze and twist. Squeezing their shoulders and talking loudly is an effective method and will awaken a sleeping person. A patient that is unresponsive should be considered unconscious. Send for help. If the patient does not respond, send someone for help. Or, if you are in a clinical area, you should activate the organization's emergency services call system. In the community, dial the emergency telephone number 000. Airway. If possible, put on protective gloves and a face shield. Suction secretions if necessary, or turn victim's head to one side unless contraindicated. You now need to open the patient's airway, making sure the airway is clear of any obstructions. If no head or neck trauma is suspected, use a head, tilt, chin, lift method to open the airway. You are able to do this with the patient flat on their back and placing one hand on their forehead and the other hand under the tip of their chin with your thumb over the chin and the middle and index finger along the jawline. Gently tilt the patient's head backward whilst lifting their chin. The mouth is opened and the tongue and soft tissues will shift away from the back of the throat, opening the airway. A jaw thrust maneuver may be used by health professionals by grasping the angles of the patient's lower jaw and lifting with both hands, displacing the mandible forwards. If readily available, now insert oral airway. Breathing. Once the airway is clear and open, then breathing can be checked with the look, listen, and feel approach. Look and feel for movement of upper abdomen or chest. Listen for air leaving the nose or the mouth. If breathing is absent, then you need to immediately commence cardiac compressions. Cardiopulmonary resuscitation. External compression of the heart is facilitated by compressing the heart between the patient's sternum and spinal vertebrae, which must be on a hard and firm surface. Commence compressions by comfortably positioning yourself at the side of the patient, parallel to the patient's sternum. The current guidelines recommend that cardiopulmonary resuscitation, or CPR, for adults, children and infants is 30 compressions to 2 ventilations, commencing with compressions. For an adult, place your hands in the center of the patient's chest over the lower half of the sternum. To provide effective compressions, you need to interlock your fingers, extend your arms and lock your elbows and position your shoulders directly over the patient's sternum. Keep your fingers off the chest wall and use the heel of your hand for compressions. Compress the sternum to 1/3 of the depth of the chest and then release the pressure. Maintain contact with the skin to ensure ongoing proper placement of your hands. Do not rock, but transmit weight vertically down. For an adult, 1/3 of the depth of the chest will be greater than 5 centimeters. It is important to avoid compressing below the lower limit of the sternum, which may result in damage to the xiphoid process or internal organs and cause regurgitation of gastric contents. For a child, place the heel of one hand on the lower half of the child's sternum. The depth of the chest compression will be approximately 5 centimeters. Until help arrives, if possible, maintain the head tilt with the other hand to maintain a patent airway. For an infant, place 2 fingers or 2 thumbs on the lower half of the sternum. 1/3 of the depth of the chest will be approximately 4 centimeters. Commence your compressions by pressing straight down on the sternum at a rate of 100 times per minute. That is a little less than 2 compressions a second. Carotid or femoral pulse may be palpated with satisfactory chest compressions. If a pulse is not palpable, compressions are not deep enough or hand position is incorrect. You need to ensure that you give 30 compressions, with each compression compressing 1/3 of the chest's depth. Compressions must be paused to allow for ventilation to be administered. Mouth-to-mouth or mouth-to-mask. Mouth-to-mouth or mouth-to-mask is used for adults and older children. To ventilate your patient, pinch their nose with your thumb and index finger and cover their mouth with your mouth. Maintaining the head tilt position, blow 2 full breaths into your patient's mouth. If one is available, use a CPR pocket mask. Each breath should last approximately 1 second and be of sufficient volume to raise the chest. Allow for passive exhalation. Mouth to nose. Mouth to nose is used for adult patients whose jaw remains clenched or for infants and small children. Keep your patient's head tilted with one hand on the forehead. Using the other hand, lift their jaw and close their mouth. Seal your lips around the patient's nose and blow. Allow for passive exhalation. Use of an ambu bag. Ventilation can also be administered using an ambu bag. If one is available, you must ensure that you use the proper size face mask and apply it under the chin and up and over your patient's mouth and nose. For all forms of ventilation, observe your patient for the rise and fall of the chest wall with each respiration. You can also listen for the air escaping during exhalation and feel the flow of air. If the lungs do not inflate, reposition the patient's head and neck and check for any obstruction such as vomitus. When providing 30 compressions at approximately 100 per minute and giving 2 breaths, you should result in the delivery of 5 cycles in approximately 2 minutes. Defibrillator. Attach an automated external defibrillator as soon as one is available. Pads should be placed on bare skin of the chest. 1 pad in an anterior position, 1 pad in a lateral position. Ensure there is good skin contact. This may require shaving chest hair. Adult pads are suitable for children over the age of 8. Pediatric pads should be used for children aged 1 to 8. Please note, diagrams of appropriate placement of the pads are provided on the pad packaging. Switch on the automated external defibrillator and follow the prompts. Avoid any wet areas. Remove oxygen from the patient and ensure that everyone stands well clear and that no one touches the patient during the delivery of the shock. Important notes. Report the incident immediately and indicate the exact location of the patient. If it is essential to move a patient onto a hard surface, such as the floor, ground, or bed backboard, before any assistance arrives, make sure you take extreme care and use good manual handling practices. If necessary, log roll the patient to the flat supine position using spinal precautions. Continue CPR until relieved, until the patient regains consciousness, until you become exhausted and unable to perform CPR effectively, or as directed by a doctor to discontinue. Record all details in the patient's notes, including treatments given, procedures performed, and the patient's response.